Constipation is one of the most common digestive problems seen in people living with HIV. But the truth is, most people have no idea why it happens. Many patients think, is HIV blocking my stomach? Is the virus attacking my intestines? Is this a sign my HIV is getting worse? Let me make it clear. HIV does not directly cause constipation, but HIV does affect several systems inside the body. Systems that control digestion, gut nerves, hydration, and the strength of bowel movements. And when these systems weaken, the digestive tract slows down. Stool becomes dry, and passing it becomes painful. Today, I'll explain the 5 medically proven reasons HIV leads to constipation, so you understand what's happening inside your body and what can be done. Number 1, weak gut motility. Slower intestines due to HIV. The digestive tract works because muscles and nerves move food forward in a wave-like motion. This is called gut motility. But HIV affects the nervous system, including the nerves of the stomach and intestines. When these nerves weaken, the intestines move much more slowly. Slow intestines equals harder stool, fewer bowel movements, difficulty pushing, bloating, heaviness, gas. This condition is known as HIV-related dysmotility, and it can happen in both early HIV, advanced HIV. Why? Because the virus causes inflammation in the nerves that control bowel movement. So food stays longer in the colon, water gets absorbed out of it, and the stool becomes dry like a stone. This is one of the most common causes. Number 2, HIV medications. Side effects in some people. Let me be clear. Modern art medicines rarely cause constipation. They are much safer and gentler on the digestive system. But older medicines or boosters can slow down the digestive tract. Protease inhibitors. Efavirenz, ritonavir, booster. These can cause tight stomach, dry stool, sluggish bowel movement, a blocked feeling. Not everyone reacts this way, but for those who do, the constipation can be severe. Good news? Simply shifting to a newer ART combination often fixes the issue completely. Number 3, dehydration and electrolyte imbalance. This is a big reason most people overlook. HIV increases the body's water needs. The body uses more fluids to fight inflammation, repair cells, and support immunity. So if a person with HIV drinks the same amount of water as before, it is not enough. When the body becomes even slightly dehydrated, the colon pulls extra water from the stool, and the stool becomes dry, hard, painful to pass. On top of that, HIV patients often have low levels of potassium and magnesium because the body uses these minerals faster. These electrolytes are essential for muscle movement, including the muscles of the intestines. Low potassium equals slow bowels. Low magnesium equals tight, cramping bowels. Together, this leads to severe constipation. Number 4, damage to the gut lining. HIV enteropathy. HIV does not only affect blood or immunity, it also affects the gut lining, even in early infection. This weakens 3 important digestive functions. Digestion. Food breaks down slowly. Nutrient absorption. Gut becomes irritated. Movement strength. Bowels become weaker. Because of this irritation, some people experience alternating constipation and diarrhea. The gut becomes sensitive and unpredictable. One day the stool is dry and stuck. The next day it becomes loose because the irritated lining can't absorb water properly. This complication is called HIV enteropathy, and it improves greatly with proper ART. Number 5. Other medications HIV patients commonly take. This is an extremely important point because constipation often happens due to medicines taken along with HIV treatment. Many HIV patients also take painkillers, especially opioids, iron tablets, antidepressants, anti-anxiety medicines, antihistamines, anti-diarrheal drugs. All of these slow down intestinal movement. So even if HIV is well controlled, these additional medicines can create severe constipation. Is HIV constipation dangerous? Not always, but ignoring it can cause serious problems like hemorrhoids, rectal bleeding or tears, severe abdominal pain, fecal impaction, dangerous buildup. And if constipation appears suddenly or becomes very painful, it can be a sign of electrolyte imbalance, thyroid problems, nerve damage reaction to a new medicine. So it should not be ignored. Is constipation reversible in HIV? Yes, in most cases, yes. Fixing hydration, increasing electrolytes, adjusting or changing medications, treating gut inflammation, switching to newer ART. These simple changes can completely reverse constipation within days to weeks. If HIV medicines are the cause, switching to a new regimen usually solves it fully. Final doctor message. Constipation in HIV does not mean the virus is worsening. It does not mean your treatment is failing. It simply means your gut needs support. When diagnosed early and treated correctly, people with HIV can have a perfectly normal digestive system and a healthy life. The key is not to stay silent. If your bowel habits change, talk to your doctor. Because the earlier we fix it, the faster your gut and your comfort returns to normal.